Good morning. I'm Dr. Michael Williams, President of the University of North Texas Health Science Center at Fort Worth. Thank you for joining us today. I'd also like to thank and welcome several key leaders in our community who are joining us virtually today. They include Tarrant County Precinct 1 Commissioner Roy Brooks, Tarrant County Precinct 2 Commissioner Devin Allen, District 5 City Council Member Gina Bivens, District 8 City Council Member Kelly Allen Gray, and former Texas Health Harris Methodist at Fort Worth President Ms. Lily Biggins. The University of North Texas Health Science Center at Fort Worth is a leader in innovative research into Alzheimer's disease, not just in Texas, not just in the U.S., but in the world. The work underway here will allow us to better understand this dreadful disease in ways that we have never been able to do before. This work underway will also help us transform the way we prevent it, the way we diagnose it, and the way we treat it. The world's first clinical trial of a blood test to detect Alzheimer's disease in the primary care setting is happening right now on this campus. Also happening is the HABLE study, a first-of-its-kind examination of the biological framework of Alzheimer's disease and how it differs between Mexican Americans and non-Latino whites. Already, almost 2,000 participants from North Texas have enrolled in this study. The National Institute of Health, the NIH, is very excited about the potential discoveries of this landmark study, and a show of their support came forward with the amount of a $45 million grant to HSC over the next 5 years to expand this study. In addition, the university committed to developing and implementing and opening recently a state-of-the-art imaging center to support this research as well. But today I'm proud to announce another significant investment into this study. HSC will invest $7 million to incorporate African Americans into this study, to expand this study to cover that community. In January, HSC will begin recruiting 1,000 African Americans over the age of 50 to undergo comprehensive functional exams, laboratory tests, brain MRIs, and PET scans to look for the biomarkers of Alzheimer's disease. This is an extraordinary opportunity for our African American community. The technology and comprehensiveness of these exams are extraordinary and second to none. And participants won't be just contributing to science. At their request, HSC will share the results with their healthcare providers so that together they can help make important decisions about their healthcare right now. So not only does this study provide the information we need to better understand Alzheimer's and how it differs across ethnicities, but it helps 3,000 people in our community make better decisions to improve their health care immediately. That's our mission at HSC, to create solutions for a healthier community. And that's why we are here today. I'm especially pleased right now to introduce you to Dr. Sid O'Brien, Executive Director of the HSC Institute for Translational Research, who leads the HABLE study. Dr. O'Brien.
Thank you, Dr. Williams. African Americans, like Mexican Americans, are around twice as likely to suffer from Alzheimer's disease, but we don't know why. They also tend to get it around 10 years younger. Unfortunately, when they are diagnosed, their symptoms also tend to be more severe. The reasons for these things are why we're doing this study. The addition of the African American community to the HABLE study has been a long-standing goal for my team. The very first research study I ever did was on memory among African Americans. The HABLE study is the only comprehensive, large-scale study into this biological framework of Alzheimer's among the 3 largest ethnic and racial groups in the United States: non-Latino whites, Mexican Americans, and African Americans. It is truly unprecedented. The funding we received this summer from the NIH was a game changer. This $45 million grant allowed the HSC to create a state-of-the-art imaging center on campus and to purchase 2 top-of-the-line PET scan systems. There is no higher quality machine available. If there's another research lab with the capabilities we now have at the HSC in brain imaging, I have yet to see it. Here's why this is so important. Our research team will conduct 2 PET scans on every participant in the HABLE study. Those PET scans will look for the amyloid plaques and the tau tangles. These are thought to be biomarkers of and pathology, the causes potentially of the disease. 2 years later, each participant will undergo those same 2 PET scans again, so we can look at how these proteins change, how they progress. This project will allow us to compare for the first time ever the differences in how these biomarkers manifest, develop, and even impact the brain among Mexican Americans, non-Latino whites, and African Americans. This has never been done. And our preliminary data already suggest that there absolutely are differences. The study will also help us understand how chronic medical conditions like diabetes and hypertension, which are also more prevalent among the African American and Mexican American communities, how these impact Alzheimer's disease. Additionally, how socioeconomic and environmental factors impact the disease. It's a very comprehensive examination. It's important to note that the data we're capturing here in this project, it's not just ours. It's not for our team's use only. We will share this data with the scientific community around the country and around the world. Scientists who are trying to understand Alzheimer's and create a better interventions and help patients earlier before the disease advances too far. I appreciate the media joining us today for helping us get the word out to the community about this amazing opportunity. Thank you.
Thank you, Dr. O'Brien. Now I'd like to introduce 2 of our key leaders to make remarks as well. Tarrant County Precinct 1 Commissioner Roy C. Brooks, a great leader, friend, and partner to HSC, and another great partner and friend, Ms. Lily Biggins, former president of the Texas Harris Methodist Hospital of Fort Worth, who spent a 45-year career in healthcare fighting to improve the health of our community and continues to do so today. Commissioner Brooks.
Thank you, Dr. Williams and Dr. O'Brien. I am happy to be with the Health Science Center today. I'm happy because I truly believe addressing the health disparities that affect our most vulnerable people and families is one of our greatest responsibilities, and it is part of my life's work. The Health Science Center is a trusted partner in this effort. This spring, as COVID-19 spread across North Texas, I was proud to work with the Health Science Center to establish a drive-through test center in my precinct in Southeast Fort Worth, so that the people who live there had access to the testing needed to help protect themselves and their families. But the African American community was impacted by health disparities long before COVID-19. Diabetes, infant mortality, and heart disease are some of the most visible health disparities affecting our community. And then came Alzheimer's disease. I became involved in Alzheimer's disease work because my mother died of what they call complications of Alzheimer's disease. So for years, my siblings and I, a group of 5, cared for our mother and watched daily as she descended into this pit of Alzheimer's disease, where one slowly loses contact with their environment, with the people who they know and love, and finally come to the point where there is no direct contact, though we always had a feeling that mother was in there somewhere, and she knew that her family was with her and that we loved her. Taking care of mother on a 24/7 basis for over 6 years of her Alzheimer's journey was a very daunting experience for us as a family, and a very expensive one as well. And it occurred to me that my sibling group and I were pretty well resourced, and we could handle the financial and emotional demands of caring for our mother. But at the same time, I knew that there were families out there who were less well resourced than our family. As a result, upon mother's death, I started the Healthy Lives Alzheimer's Symposium and the Health Science Center was always a reliable partner in this annual event to bring resources to our community. And in fact, Dr. Sid O'Brien served as the keynote speaker for several years as we gave this symposium. He introduced our constituents to the concept of biomarkers testing, which is a key ingredient to this new grant program that we're rolling out today. I am absolutely thrilled to be able to partner with the Health Science Center on this effort to reach out to Hispanic and African Americans suffering from Alzheimer's disease. I am prepared to serve as that credible messenger that bridges the gap between the Health Science Center, who's got the research and the latest in Alzheimer's disease technology, and the African American and Hispanic communities that need that information so badly. That bridge is the key to the success of this program, and I am committed to be that bridge. I look forward to working with Dr. O'Brien to build a trustful relationship to help share this unique opportunity with those who qualify for it. If you know someone who could benefit from this research study, I encourage you to take steps to find out if they qualify. Not only could it help improve their health right now, but it can help lead to discoveries that one day protect our next generation from this awful disease. Thank you, and I will now turn it over to Lily Biggins.
Thank you. I'm grateful to join you today. During my healthcare career, I've seen the tremendous impact the Health Science Center has made in Fort Worth. not only here in Fort Worth, but throughout the Metroplex. In fact, years ago, I was a nurse in the ICU at the Osteopathic Medical Center of Texas, the hospital that once stood on the Health Science Center campus. During my career in healthcare, I've seen the terrible impact of Alzheimer's disease, not just on the people who have it, but on their families and loved ones. I remember a distraught employee who came to me one day because she needed to talk. I told her, sure, come on around and we can talk. And she had driven to Oklahoma to visit her mom, who suffered from Alzheimer's. And her mother no longer knew who she was. Not only did she not know who she was, but she didn't know the other family members. She, of course, was devastated. Additionally, I saw my pastor start to get confused in the pulpit as he was starting a sermon. And he could no longer continue in the pulpit after a while. Alzheimer's disease robs people of their personalities, their memories, their self-reliance, the essence of who they are. From their families and loved ones, it's absolutely devastating. It changes life as they know it, because now they're transitioning to doctor's appointments. They worry about keeping a loved one safe. My pastor used to try and cook in the middle of the night, a morning, because he always cooked for the church. And it just threw his wife into a panic when he was in the kitchen. One night he started a fire. Of course, he didn't know, because of the profound sadness that he was going through, losing his control. Think about the grandparents who no longer recognize their grandchildren. I have several, and trust me, there are days when I wish I didn't recognize them, but for the most part, I love them as our Alzheimer's patients love their grandchildren. It takes a terrible toll on the patient, and it takes that same terrible toll on the family. The innovative research underway at the Health Science Center offers hope. Hope that one day we can detect Alzheimer's much sooner. Hope that we can treat it, slow it down, stop it, and ultimately maybe not have it at all. Hope that one day we can cure people of this awful disease. So I invite the community to join me in supporting this important research. It is an extraordinary opportunity for Fort Worth and North Texas. Please join us. And thank you for having me here today.